Have you ever heard the saying, more is better? When it comes to medical checkups after 70, that might not be true at all. Imagine this. You're in your 70s, feeling relatively well, and you go in for a routine screening, just to be safe. But that one test leads to another. Then a biopsy. Then a treatment you didn't need. And suddenly, you're caught in a medical maze that's taking more from your life than it's giving back. The truth is, some health checkups that were helpful in your 50s or 60s can actually harm you in your 70s and beyond. Not because medicine has failed, but because your body, your goals, and your needs have changed. Yet, too many seniors are still going through unnecessary tests, risky procedures, and stressful follow-ups that offer little to no benefit and sometimes do real damage. Today, we're going to talk about 5 common health checkups that you should think twice about after 70, and why avoiding them could actually be one of the best health decisions you make. This isn't about ignoring your health. It's about protecting it by focusing on what truly matters in this stage of life. Let's take a deeper look. After the age of 70, many people believe that frequent and comprehensive health checkups are the key to staying healthy. While some screenings and medical tests remain important in later years, there is growing concern in the medical community about the risks of over-testing in older adults. One of the most important things seniors and their caregivers should understand is that more testing does not always mean better care. In fact, in many cases, over-testing can lead to over-treatment. And this can actually do more harm than good. As we age, our bodies naturally change. The likelihood of certain diseases increases, but so does the risk of complications from diagnostic procedures. What's often not discussed is that some of these routine health checkups, those that are encouraged when we are younger, can become risky or unnecessary after the age of 70. Seniors are more vulnerable to the side effects of certain tests, and the results may lead to a cascade of treatments, medications, or surgeries that carry greater risks than benefits for people in this age group. For example, many older adults are still advised to undergo regular cancer screenings like colonoscopies, mammograms, and prostate-specific antigen (PSA) tests. While these tests can be life-saving in younger individuals or in those with a long life expectancy, they may not be necessary or even safe for someone in their 70s or 80s, particularly if they have other health conditions. A colonoscopy, for instance, can involve anesthesia, preparation with strong laxatives, and a risk of intestinal injury or bleeding. For someone who is otherwise frail or has multiple chronic illnesses, these risks can outweigh any potential benefit, especially considering that colon cancer typically takes years to develop. Another example is PSA testing for prostate cancer. Elevated PSA levels can lead to further procedures such as biopsies, which can cause pain, infection, or even hospitalization. In many cases, prostate cancers found in older men grow so slowly that they would never cause harm during a man's remaining lifetime. Yet the emotional stress of a cancer diagnosis often pushes people toward aggressive treatments like surgery or radiation, which can come with side effects like incontinence and sexual dysfunction, issues that severely affect quality of life with limited benefit. When test results are ambiguous or lead to false positives, seniors may be subjected to a stressful and dangerous cycle of follow-ups, second opinions, and more invasive procedures. The emotional toll of waiting for results, worrying about what they mean, and going through repeated appointments can cause significant anxiety. At this stage of life, mental peace is an essential part of well-being, and unnecessary testing can rob seniors of that peace. Overtesting can also lead to overtreatment through the overprescription of medication. Seniors are already at risk of polypharmacy, being on too many medications at once, which increases the chances of dangerous drug interactions, confusion, and falls. Sometimes, a test can reveal a minor issue that might not be causing any symptoms, but a doctor may still feel pressured to act on it. The result is more pills, more appointments, and a higher chance of side effects. Beyond the physical and emotional risks, overtreatment also contributes to financial stress, both for seniors and their families. Many diagnostic procedures are expensive, and while some may be covered by insurance, others are not. Seniors on a fixed income may find themselves paying out of pocket for follow-up visits, medications, or treatments that provide little to no improvement in their actual health or quality of life. This financial burden can add to stress and reduce access to services that are actually beneficial, such as physical therapy, nutritional counseling, or social support. The core issue is that many of the tests that once made sense in earlier adulthood are now being applied without adjusting for age, health status, or personal goals. It is easy to fall into a pattern of routine checkups just because that's what we've always done. But after 70, healthcare decisions must be more thoughtful and individualized. Overtesting can lead people down a path they did not expect or want, away from a focus on living well and toward a cycle of managing complications from unnecessary medical interventions. The goal of senior healthcare should not be to detect every possible illness, but to ensure that a person is able to live comfortably, maintain their independence, and enjoy meaningful activities. This means being selective and strategic about which checkups to pursue. Doctors and patients must have open conversations about life expectancy, personal values, and what the patient actually wants from their care. In many cases, doing less can actually mean living more fully. Avoiding unnecessary tests doesn't mean neglecting health. It means protecting it by avoiding harm that can come from overdiagnosis and overtreatment. As people age, especially after the age of 70, the way medical care is approached should shift significantly. Health is not a one-size-fits-all matter, particularly in later years when every individual has a unique medical history, physical condition, and personal priorities. However, many seniors are still subjected to standardized medical routines that were originally designed for younger populations. The same health checkups that may have been appropriate and even necessary in one's 50s or 60s can become excessive, irrelevant, or even harmful in one's 70s and beyond. This is why it's critical to move away from a blanket approach to healthcare and start focusing on personalized, age-appropriate medical decisions that respect the unique needs of older adults. Many medical guidelines are based on large population studies that average out data across a wide range of people. These studies may indicate that certain screenings lower the risk of disease or death, but they often don't account for how the effects differ in older individuals with multiple chronic conditions, reduced mobility, or limited life expectancy. For example, recommending the same frequency of mammograms or bone density scans to a healthy 50-year-old and an 85-year-old woman with diabetes, arthritis, and limited physical activity doesn't make sense. Their health conditions, goals, and tolerance for treatments are completely different. Yet, in many healthcare systems, there's still a strong tendency to apply general guidelines without proper adjustment for individual circumstances. A critical aspect of aging is that the balance between risk and benefit starts to change. A test that might catch a disease early in a younger person and lead to successful treatment may not have the same value in an older adult. That's because the chances of slow-growing or non-aggressive conditions increase with age, and the risks associated with follow-up tests or treatments become more significant. Seniors may face complications from anesthesia, slower recovery times from surgery, or dangerous side effects from new medications. Therefore, applying the same medical logic to everyone, regardless of age or overall health, is not just ineffective, it can be dangerous. Another factor to consider is that seniors have a wide range of health profiles. One 75-year-old might be walking several miles a day, eating well, socializing, and managing only minor health issues. Another 75-year-old might be dealing with advanced heart disease, poor mobility, or cognitive decline. It would be unfair and unsafe to subject both to the same health screenings or treatment plans. Personalized care is about recognizing these differences and making medical decisions that are tailored to each person's unique reality. When health checkups are too aggressive or too frequent in older adults, they can create unnecessary fear and anxiety. Seniors often feel pressured to go through with tests simply because they were recommended, even when they do not fully understand the reason or benefit. They may worry that refusing a test means neglecting their health, when in fact, the smarter and safer choice might be to skip it altogether. Personalized care involves educating seniors about what's truly necessary for their health and helping them make informed decisions that align with their values and lifestyle. There's also the issue of time and energy. Frequent appointments, long waits in hospitals, traveling for tests, and dealing with confusing medical instructions can all take a toll on an older person's quality of life. Seniors have limited energy and may prefer to use their time enjoying life, spending time with family, or engaging in relaxing activities rather than attending endless doctor visits for checkups that offer little real benefit. A one-size-fits-all approach to health care fails to take this emotional and mental toll into account. Moreover, not all seniors want the same thing from their health care. Some may prioritize longevity and be willing to undergo extensive tests and treatments. Others may prioritize comfort, independence, and quality of life. That's why personalized care begins with asking the right questions. What does the individual want out of their health in the years to come? What trade-offs are they willing or not willing to make? Without those conversations, medical decisions are made blindly, based on statistics rather than human needs. Even doctors sometimes struggle to shift from a disease-focused approach to a person-focused one. Medical training often emphasizes early detection and intervention, but as patients age, the focus needs to change. Health professionals must learn to listen more closely, consider the whole person, and recognize that for many seniors, avoiding unnecessary interventions is just as important as receiving treatment for real medical issues. Personalized care also helps avoid unnecessary expenses. Not all tests and follow-ups are covered by insurance, especially if they are not clinically necessary. For seniors on fixed incomes, wasting money on generalized tests can prevent them from accessing services that would actually benefit them, like physiotherapy, nutritional advice, home care, or mental health support. By tailoring care to the individual, resources can be used more effectively and meaningfully. In summary, a one-size-fits-all approach does not serve the elderly well. After 70, healthcare should be built around the individual, taking into account their overall health, medical history, preferences, and priorities. Every senior deserves to be seen as a unique person, not just another patient following a standard medical checklist. This shift in approach not only prevents unnecessary harm, but also respects the dignity, independence, and personal values of older adults. As people grow older, especially beyond the age of 70, it becomes essential to weigh the benefits and risks of medical tests and procedures more carefully than ever before. Many common health screenings that are widely promoted for adults, such as colonoscopies, prostate cancer screenings, and repeated imaging tests, can actually be more harmful than helpful for seniors. This is not because the tests themselves are inherently bad, but because the context changes with age. The human body becomes more fragile, the immune response slows down, and the likelihood of complications from medical interventions increases. Therefore, what might have been a beneficial and even life-saving test earlier in life may now carry unnecessary risks or lead to treatment of conditions that would never have caused problems in the first place. One of the most frequently discussed examples is the colonoscopy. This test is used to detect colon cancer by inserting a long, flexible tube with a camera into the colon. While it is a valuable tool in younger and middle-aged adults, especially those with a family history of colon cancer, it can pose significant risks for older adults. The preparation for the test requires consuming powerful laxatives that can cause dehydration, electrolyte imbalance, and fatigue. The procedure itself often involves sedation or anesthesia, which can increase the risk of confusion, falls, and cardiovascular complications in elderly patients. In some cases, colonoscopies can even result in perforation of the colon or bleeding, particularly in people with weakened tissues or those taking blood-thinning medications. Similarly, prostate-specific antigen (PSA) testing for prostate cancer is often recommended for men in their 50s and 60s. However, in men over 70, this test is controversial. Elevated PSA levels can indicate the presence of prostate cancer, but many of these cancers are slow-growing and may never cause symptoms or threaten a man's life. Despite this, a high PSA result often leads to biopsies, which carry risks of bleeding, infection, and pain. Even more concerning is the cascade of events that may follow: surgery, radiation, and hormone therapy, all of which can result in serious side effects like urinary incontinence, sexual dysfunction, and a significant decline in quality of life. In many cases, these outcomes are worse than the disease itself, particularly if the cancer would not have progressed during the person's natural lifespan. Another common practice that should be reconsidered in older adults is the frequent use of imaging tests, such as CT scans, MRIs, and X-rays. While these tests can be helpful for diagnosing specific issues, they are often overused, especially when symptoms are vague or unexplained. In seniors, these tests can uncover incidental findings, benign abnormalities that would never cause harm but trigger concern simply because they are discovered. These findings often lead to more tests, biopsies, or even surgeries, all of which carry risks that may outweigh any benefit. For example, a small lung nodule found during a scan might lead to a biopsy or surgery despite being non-cancerous or slow-growing. The procedures themselves, however, could result in infection, bleeding, or even hospitalization, outcomes that significantly impact a senior's well-being. Even simple procedures, like routine blood tests, can sometimes cause unintended consequences in seniors. A minor irregularity in lab results may lead to additional testing or new medications, which then introduce more variables and possible side effects. The more testing that is done, the more likely it is that something questionable will be found. This is known as overdiagnosis. The identification of a condition that would never have caused harm if left undetected. Overdiagnosis leads to overtreatment, which can create a domino effect of unnecessary and sometimes dangerous interventions. The emotional impact of unnecessary testing is also worth mentioning. Seniors may experience increased anxiety and stress after receiving test results, especially if the results are unclear or require more follow-up. The uncertainty can lead to sleepless nights, worry about one's future, and a sense of fear that overshadows daily life. For people in their later years, emotional and mental well-being are just as important as physical health. Repeated medical procedures, especially those that are invasive or inconclusive, can create a feeling of being trapped in the healthcare system with little sense of control or peace. Furthermore, these unnecessary tests often distract from what really matters in senior healthcare: maintaining functional ability, independence, and comfort. Time and energy spent preparing for and recovering from procedures could instead be used for physical activity, social connection, hobbies, or rest. Seniors deserve healthcare that supports their life goals, not care that pulls them into a cycle of hospital visits, treatments, and complications. Medical science has made great strides in the detection and treatment of diseases, but there is growing recognition that some practices need to be adjusted for older adults. Just because a test is available does not mean it is always appropriate. In senior healthcare, the focus must shift from aggressive detection of every possible illness to a more thoughtful, individualized approach that weighs the real value of any test or treatment. The goal should always be to do what helps the patient most, and sometimes that means choosing not to test at all. In conclusion, when it comes to senior health, especially after the age of 70, being selective and thoughtful about medical checkups is not only wise, but necessary. Overtesting can lead to overtreatment, causing more harm than benefit in many cases. A one-size-fits-all approach fails to consider the unique needs, conditions, and life goals of older adults. Some screenings that were once essential may now pose risks that outweigh their value, particularly when they lead to unnecessary procedures, emotional distress, or a decline in quality of life. The focus of healthcare for seniors should shift toward preserving comfort, independence, and overall well-being rather than chasing every potential disease. By choosing smarter, more personalized medical care, seniors can avoid harmful interventions and instead enjoy a healthier, more balanced life in their later years.